Boston University Health Plan, how the Blue Cross Blue Shield PPO works. The PPO plan uses the Blue Cross Blue Shield National Network of Physicians. Included in the national network are the Boston Medical Center physicians. You also have the option to see providers outside the national network. The Blue Cross Blue Shield National Network plus providers outside the national network equal your total provider choice. If you see BMC providers, you pay less for health care and you save on everything from doctor office visits and x-rays to hospital care. BMC providers are available at the BU Charles River Medical Practice located at 930 Commonwealth Avenue. If you see other Blue Cross Blue Shield network providers, you'll pay more than you would with a BMC provider, but less than you would with an out-of-network provider. Physicians' visits are covered by a copayment, and hospital services are subject to coinsurance after the annual deductible is met. You'll pay less if you choose a Blue Cross Blue Shield low-cost hospital. Finally, you do have the option to go outside the Blue Cross Blue Shield network. If your provider is not in the Blue Cross Blue Shield National PPO network, out-of-network benefits apply. You are still covered by the plan, but your out-of-pocket costs will be higher. The out-of-pocket maximum is the most you pay each year. Copayments, or a flat dollar amount, apply to doctor's office visits, emergency room visits, and prescription drugs. The deductible does not apply to services subject to copayments. The deductible, or the annual amount you pay before the plan begins to pay benefits, applies to services that are subject to coinsurance. This includes services such as x-rays, labs, and other diagnostic tests, as well as hospital care. If your provider is out-of-network, you must reach the out-of-network deductible before the plan starts sharing in the cost of care, except for emergency room visits. Once you meet the deductible, you pay a percentage of the cost of care. This percentage is called your coinsurance. The out-of-pocket maximum is there to protect you from high out-of-pocket costs. Once you reach the out-of-pocket maximum, the plan pays 100% of eligible expenses. It's important to note that the new PPO plan has separate medical and prescription drug out-of-pocket maximums. And remember, annual physicals are covered 100% by the plan when you see an in-network provider. Let's look at what you pay in-network for the PPO plan. Preventative care is covered at 100% in-network. For non-preventative care, you pay less when you use in-network providers. Your costs are lowest when you receive care from a Boston Medical Center provider. Your coinsurance costs are also lower when you use a low-cost hospital instead of a high-cost hospital. Also, it's important to note that if you enroll dependents in coverage under the PPO plan, when a family member meets the individual deductible, $250, the plan begins to pay benefits for that one person. If 3 family members, or some combination of all family members, reaches the family deductible of $500, the plan begins to pay benefits for the entire family. The same applies for the out-of-pocket maximum. Let's look at what you pay out-of-network in the PPO plan. You must satisfy the plan deductible before you are covered for any services out-of-network. Once the deductible is met, you pay 30% of the cost for your care. Also, it's important to note that if you enroll dependents in coverage under the PPO plan, when a family member meets the individual deductible, $500, the plan begins to pay benefits for that one person. If 3 family members, or some combination of all family members, reaches the family deductible of $1,000, the plan begins to pay benefits for the entire family. Here is the list of Blue Cross Blue Shield high-cost hospital providers in Massachusetts. All other hospitals provided are considered low-cost. Services include x-ray, lab, and related diagnostic tests, as well as inpatient and outpatient care. Now let's look at your prescription drug coverage. Prescription drug benefits are provided through OptumRx, not through Blue Cross, and enrollment is automatic when you enroll in a university healthcare plan. You will receive a separate pharmacy benefit card from OptumRx. Your share of the prescription drug cost depends on whether your drug is classified as a generic, preferred, or non-preferred. You will pay the least for generic medications and the most for non-preferred medications. Non-preferred medications are those not listed on the Optum Rx formulary. If you take maintenance medications, you can enroll in the home delivery program or CVS retail locations and save time and money. As a reminder, there is a separate out-of-pocket maximum for prescription drugs, as shown here. Let's turn our attention to the Healthcare Flexible Spending Account. If you enroll in the PPO plan, you will automatically receive a contribution from BU to a Healthcare Flexible Spending Account if you earn less than $100,000. The amount BU contributes depends on your coverage level and annual salary. The money may be used to pay for eligible healthcare expenses and may be used right away. You can use the FSA to pay for copayments, deductibles, coinsurance, prescription medications, and more. This includes qualified dental expenses. You also have the option to contribute an additional pre-tax dollar amount from your pay to the FSA healthcare up to the IRS limits. Certain restrictions apply to these accounts, so be sure you understand how they work before electing to contribute. To learn more about the Blue Cross Blue Shield PPO, please visit the HR website to view the comparison chart, coverage advisor tool, contribution rates, as well as the BU Human Resources website.